A very good evening, everyone. My name is Dalila. I'm an optometrist from Vista Eye Specialist, and it's going to be my pleasure and honor to serve you as moderator for this live session today, which is devoted to the topic as of the danger of tree highs on your eye. Welcome to today's live webinar, which is proudly brought to you by Vista Eye Specialists in collaboration with esteemed partner, International Medical University, IMU. Thank you all for being here with us this evening. The titles of today's talk is The Danger of Tree Highs on Your Eye. We will talk about the impact and medication to control the tree highs. I am very excited to learn along with you as we hear from our distinguished speakers very soon. Let me share a little bit what Vista does and also for IMU. For Vista, we have been established since 1999 and we have proudly been in this industry for 21 years. Over the years, we have been helping people from blur to clear with numerous services such as kids eye exam, myopia control program, refractive and cataract surgery since then. Up till this moment, we have 11 centers in Malaysia and 4 new centers are coming up soon. International Medical University, IMU, is Malaysia's first and most established private medical and health sciences university. With 28 years of dedicated focus in healthcare education, the university is known for its wholly specializing in medicine, health sciences, and complementary medicine program. Moving on today's agenda, you'll be hearing a presentation on this very timely subject from our specialist doctor, Dr. Chai Kai Siang, who is a consultant ophthalmologist, cataract and refractive surgeon of Vista Eye Specialist, in which he'll be covering the topic, how the tree highs affecting your eyes, followed by the topic, medication usage to control the tree highs by very competent pharmacist, Dr. Chong Chin Pin of International Medical University. Each speaker will have about 12 minutes for their sharing, and towards the end, we'll be running a live Q&A session with all our speakers, where we'll try to address your questions, as many as we can within the allocated time frame of about 20 minutes. I would like to encourage all of you to start sharing your questions and thoughts in the comment box as we go along during this live webinar. So what are these tree highs? These tree highs are high blood pressure, high cholesterol, and high blood sugar. I want to share a few facts regarding our topic today. According to a research conducted by the Ministry of Health, MOH, in 2019, an estimated 3.9 million adults in Malaysia aged 18 and above had diabetes, higher than 3.5 million in 2015. Apart from that, more adults suffered from hypertension as of last year at 6.4 million people in Malaysia. In conclusion, about 8.1% or 8 million adults in Malaysia have all three risk factors for diabetes, hypertension, and high cholesterol. The question now, how will these three conditions connect to your eyes? That is what our speakers will elaborate more, since this is an important topic that can impact on one's quality of life. We are honored to create this panel to share with all of you on how the tree highs affect your eyes and medication to control it. On behalf of our viewers today, I would like to express our gratitude to our partner for this live session, International Medical University. So, for those of you just joining us, welcome to our live session and stay tuned because we are having a giveaway afterwards. You just have to share this live session and be the first 5 to answer the questions correctly. 5 sets of exciting gifts will be given away. Now, moving along to our first segment today, Dr. Chai Kai Siang, a fervent ophthalmologist from Vista Eye Specialist. Throughout his years on helping people, he believed that early detection and treatment is crucial before it jeopardizes your vision. It is a great honor to have Dr. Chai enlighten us with how the tree highs affecting your eyes and the consequences can be more serious than we think. With that, Please join me in welcoming Dr. Chai Kai-Siang.
Okay, good afternoon, everyone. Thank you, Dalila, for giving me the mic on my topic on the impact of tree heights on our eye. So actually, I would like to say that thank you, and I feel very honored today to give a talk on this impact on tree heights, because I think that is important to increase the awareness in the public regarding the impact of the tree heights on our eye. So first, let's start. What is tree heights? As what our speaker Daria already mentioned, tree heights is actually a common chronic diseases, okay, whereby we already know what is high blood pressure, also known as a hypertension, high cholesterol, hyperlipidemia, high blood pressure, sugar, diabetes mellitus, and all these three heights is actually related to our modern lifestyle, which is we all always like think of nowadays. People always work very hard, and then there's a lot of stressful life, unhealthy lifestyle, and then unhealthy dietary, lacking of exercise. All this will subject to three heights. So let's move. The important to diagnose three heights. So how we know that when we have diabetes mellitus, when we have hypertension, when we have hyperlipidemia? So we need to go through the guideline. Okay. So make it as simple. Actually, it's quite straightforward. So any blood pressure that consider optimal is 120 millimeter mercury, where your diastolic blood pressure should be 80 millimeter mercury. So anyone that have a risk to have a hypertension is more than 130 to where your diastolic is 85 to 89. Those is considered higher risk to have hypertension. For those already diagnosed to have a stage 1, stage 2, or stage 3, any systolic blood pressure above 140 and 90 diastolic blood pressure will consider as a hypertension. So the prevalence in Malaysia already well shown here. Most of us is fall into these two categories of at risk and stage 1 hypertension. So how do we diagnose for hyperlipidemia? So normally we need to get a fasting blood sugar, where you need to fast over the night, before, without eating anything, or just take a sip of fruit. So from the blood result, we can see that the total cholesterol is more than 5.2. And let us not forget that in cholesterol level, that is a high density lipoprotein, which is a good lipid in our body fat. And the triglyceride and low density lipoprotein cholesterol is actually bad cholesterol in our body. So when we know we have a hyperlipidemia, so it's more than 1.7 triglyceride level and more than 2.6 for our LDL level. But don't be worried, this will be checked by your treating doctors, so they will diagnose it properly. So what you need to do is just to get a fasting blood sugar and fast properly beforehand. So how to know that we have a diabetes mellitus? Okay, so the same will go to what we need to fast over the night. Then we have the fasting level. If any blood sugar level is more than 7 milliliter per liter, and the random is more than 11.1 millimole per liter, so it's considered as a diabetes. So from the HbA1c per se, what is HbA1c? Is actually is an average of the blood sugar level around 3 months time. Is just a burrata or average. So anyone that have more than 5.6 millimole per mole is considered, less than that is considered normal. Anyone that have more than that is considered as a pre-diabetes or diabetes level. So let's move on. So actually, when we have these three heights, what is the consequence to our blood vessels? So I will start with hypertension. Hypertension, where there is a presence of persistent high level of hypertension, which your blood pressure is more than 140 systolic and diastolic 90. So from the diagram, you have seen that in a normal range, the blood vessel is normal without any narrowing. Due to a prolonged effect of the hypertension, you can see that the wall of the vessels is actually getting narrower. So you have all this pre-hypertension stage, hyperstage is getting more narrower, which is disturb the blood flow to the body. So for high cholesterol pathogenesis, where there's a formation of cholesterol plaque, as shown in the diagram. So this plaque will cause the thrombus formation in the end and eventually cause the blockage of the vessels. So this is also one of the danger. So for diabetes mellitus pathogenesis, so mainly in a high blood sugar level, the wall of the blood vessels will get compromised. What's the reason of compromise? Because there's the endothelial damage of the vessels, so which lead to all this weakening of the vessels and further secular outpushing, and all this blood constituent from the blood vessel will leaking out and cause all these problems in the long run. So let's move on. What is risk factors? So genetics risk factor is something that we cannot modify, but it is known case of one of the possible cause for these three heights, followed by age, because more elderly, the vessel is more stiff and more fragile. I would like to say that. So for male is more predominant than the female. So let's move on. As what I mentioned, modern lifestyle have a stressful lifestyle, lacking of exercise, obesity due to unhealthy dietary and diet intake, and chronic smoking can cause further damage and aggravate the condition of the vessels. So how three heights impact over our eye? Okay, let's move on. So the effect, as I described earlier, the hypertension on the blood vessels can cause the narrowing of the blood vessels, especially at our retina. Our retina full of all these fine vessels and moderate to large medium vessels. So mainly it will affect to our small vessels. So in the eye, because at presence of numerous vessels, there's more like a fine vessel. So presentation will be in our eye first. That's quite common. So in hypertension, because of the attenuation of the arterioles, the retina arterioles and artery, it can cause the narrowing. And it could lead to a stroke, eye stroke, whereby your artery is occluded. So what you can perceive is like the left side, the lower quadrant will be blurred because of the superior quadrant is having the stroke. Let's move on. What could happen if we have a hypertension quite high? So in a hypertensive retinopathy, so what we can see is actually there's a presence of the deswelling, and also the vessels arterioles is attenuated and narrowing. And at the junction of these vessels, where the vein and the artery crossing, we can see the AV nicking sign, where because of the chronic hypertension, the artery is pressed on the vein. So it can have AV nicking. So in the macula is an important structure of the eyeball, which control our central visions. So there's a leaking out all this fluid, and we could become a blur like this image. So we cannot ignore. If we have hypertension, we need to treat accordingly. So let's move on. What could possible if patient develop hypertension? So central retinal vein occlusions. So vein also will be affected because the artery is compressed over the vein. So the vein have this kind of problem, occlusion. So what we can perceive is like the left side. It's like a left side, there's a patchy, like the visual field defect, like a scotoma. So let's move on. So what's the treatment plan we can offer? Definitely need to optimize medically. The blood pressure optimization is very important. Go to your treating doctors and go to your GPs. So make sure that the blood pressure is always well controlled. And then in certain stage and certain diseases, whereby there is a need for further interventions, depends on the severity of the problem. So you might need an injections. Injection, normally we will give an intravitreal antivascular endothelial growth factors. So with this, it can relieve the swelling. Further on, there will be no any scarring. So it will cause no irreversible blindness in your eye. So in a more severe case, we might do a pan-retina photocoagulation laser to control the eye problem, so that it won't progress to be more worsened, is to retard the progressions of the problem. So let's move on. What is the effect of the uncontrolled diabetes, persistent? So what we could see here, that is the cataract formation will be earlier, much earlier compared to a normal people. So because of the metabolism in the lens is disturbed. So the electrolyte imbalance or these metabolic disorders, so it cause more prone to have cataract. So this type of cataract normally is presented with a posterior capsular cataract opacification. So what we can see the image is a generalized blurring. So for a proliferative diabetic retinopathy, like this image is quite advanced of the diabetic retinopathy. So where you can see there's an optic disc blur, a slightly swelling. There's a lot of dot plot hemorrhage in the retina. There's a pre-retinal hemorrhage. They also having a hard exudate. So the macula could be swollen. We call it as a macular edema. So in this case, you can see like there is a metamorphosis, the central scotoma, which your central vision is get disturbed, is impaired. So compare to the other problem. So let's move on. What happens if your high blood pressure is persistently uncontrolled, persistently out of control without any treatment? It could be present in your eye, whereby at the front of the eye, you can see like a bleeding, like a right side, these photos. We call it as hyphema. So in the long run, there's new vessel form in the iris. Okay, so this problem can further aggravate to lead to neovascular glaucoma, also one potential ocular blinding conditions. So you need to seek for treatment earlier if you have all these problems. In the eyeball, there's also presence of retinal hemorrhage into the vitreous. So pre-retinal hemorrhage, also a vitreous hemorrhage. So what we can see, the patient will normally complain with the floaters. Floaters will become worsening. To a very more severe case, you will get to flashes of light, where there's a presence of tractional retinal detachments. So in this kind of case, patient will complain of flashes of light and floaters. If you have all these symptoms, please be no doubt to come and seek for expert opinions. So what's the treatment for this problem? So definitely you need to have a very good blood sugar optimization. You need to treat according to your own doctors, treating doctors, your own GP. So you need to have a serious blood checkup to ensure that you have an optimum blood sugar level. So if you have presence of a cataract, you need to do an early cataract surgery in order to get a clear vision. So let us not forget that if there's a presence of hemorrhage in the vitreous, if there's any macular edema, macular swelling, which your central vision disturbed, you might need argon grade laser therapy or anti-VEGF treatment, injection, or in a more severe form of diabetic retinopathy, like proliferative diabetic retinopathy or advanced diabetic eye disease, you might need to have a laser. You call it as a pan-retina photocoagulation laser. Mainly is to laser the peripheral side of the retina to control the disease from become worsening, other than cure the disease. Okay, so let's move on to the high cholesterol, hyperlipidemia effect over the eye. So what we can see here is actually there's a front part of your eye. There is an eruptive xanthoma over the eyelid or over your left side photos. There's a prominent corneal arch at the peripheral of the cornea, the whitish patch, like a ring shape, because of this deposit of cholesterol all over the cornea. Also presence of xanthelasma. There is a lipid pad over the upper corner of your eyelid. So all this is a sign of you already have a high cholesterol. So what happened in the eye? You could get a retina or central retinal artery occlusion. So where you have all this stroke, what is this stroke danger about? It's a sudden onset of stroke, sudden onset of artery block. Is a potential sight-threatening conditions. So you need to have a immediate and emergency medical consultant to any eye specialist nearby. So what you can see is the sudden onset of total blindness if you have a central retinal artery occlusion. If you have a branch retinal artery occlusion, normally it's just a hemifield. It depends on the location of the occlusion. If it's superior, you have an inferior visual field blindness. It's a partial blindness. So what we'll do, if that is the problem is less than 24 hours, we will try our best to do ocular resuscitations to restore the blood flow of the retina. We'll do all sort of ocular massage to bring down the intraocular pressures by medications. So in order to increase the oxygen perfusion to the eyeball. So what we could do after we have all this problem, so we need to make sure that our tree height is well optimized medically, okay? Then after that, if we are more severe case, there might be a new vessel formations. So in these new vessel formations, we need to do another laser, just as I described just now. We need to control the disease so that in order to prevent it become worsening. So this is important to control the 3H. Okay, so take home message. I think more of you already clear what I'm trying to say just now. So what I want to emphasize here is always remember 3 things. Remember. Detect must be early detections. And once you are diagnosed with all these 3H, you need to be very compliant to your medications as prescribed by your treating doctors. So also let us not forget that to practice a healthy diet and lifestyle, also very important to control 3H. So followed by a regular follow-up with your doctors and eye specialists, have a routine checkup annually. Initial stage, if once diagnosed, normally you need to close monitor of your disease. If let's say there's a more stable, your problem already well controlled with all this therapy that I mentioned before, so you need to have a longer follow-up or maybe annual checking to ensure that there's no any other devastating complication over your eyeball. I would like to say thank you to giving me time to present all this topic. Thank you very much.
Thank you, Dr. Chai, for the informative sharing and the great introduction to the 3 highs and how it affects our eye. I think our viewers must have been very much delighted to know more about 3 highs and how it actually affecting on eyes. And as for your viewers who are currently watching us live, if there are already some questions on your mind now, please feel free to drop your questions in the comment box and we'll address as many as we could later at the Q&A session. As Dr. Chai briefly mentioned earlier, the effect of 3 highs to your eyes can be reduced with great control of the 3 highs. However, I'm pretty sure many of us might be overwhelmed or even thinking, should I take the medication? To answer that, we are indeed extremely privileged to have our next speaker, Dr. Chong Chin Ping, with us today to share and guide us on how to put a stop to 3 highs. Dr. Chong obtained his Bachelor of Pharmacy degree in 2015. Subsequently, he obtained his Doctor of Pharmacy degree at the University of Cyberjaya. Dr. Chong is currently the Vice Chairperson of the Malaysian Pharmaceutical Society Young Pharmacist Chapter, a core committee of MPS Hospital Pharmacy Chapter, and a member of Academy of Pharmacy. His favorite quote is, "It is never too late to take action," and it resonates well with what we are discussing today. So, without further ado, I'd like to turn things over to Dr. Chong Chin Ping. So, over to you now, Dr. Chong.
Thank you very much, Dalila, for your kind introduction. Just a moment. All right. So without further ado, I think I'll just proceed with how should we handle our medications in respect to 3 highs as well as our eye issue. So to be honest, very frank, hypertension, high blood sugar, as well as high cholesterol in blood, either one of these topics is a very huge area. We can spend almost a week just to talk about one of the issue. But today, I'm just going to try to squeeze everything into 12 minutes. And that is what I want to tell you and what we can do, the best way to prevent any complications with 3 highs and any eye issue. So just a very brief introduction that I believe Dr. Chai has mentioned about it. The 3 highs itself, I'm just going to take hypertension today to talk about some of the statistics. According to the statistics, nearly 30% of adults have hypertension. This is globally, yeah. So means that out of 10 people, 3 of us will have hypertension, including myself. This is for all the adults. And out of this 30%, only 50% of them are aware they are having hypertension. Okay, and only a small, not all of them is actually willing to take any medication or to take any treatment for them to treat for the their 3 highs. And the worst thing is that these 3 highs, most of the time, they don't have any obvious symptoms. That is the worst part. So they are also called the silent killer. You will never notice that you have a hypertension, high blood glucose, or high cholesterol level until you go for a checkup. That is how dangerous it is. And when you have realized that there's something wrong with your body, it is most of the time it's too late already. It has been manifested and it has some complications going on. It can damage your kidney already. Your eye can already have some poor vision. And then only you start to realize, oh, I have some hypertension, I have high blood glucose. That is already too late for us to take an action. But yet we still can do some modification based on it. All right. So what we need to do as a public, we need to be aware of what is our risk factor and make a change on that matter. So as soon as we detect you are at risk or you are having some hypertension, pre-diabetes, or pre-high cholesterol, we can make a move on it. All right. So this is the best way that we can handle it. Preventing it from happen is always the best way to cure it. It's compared to having an eye problem and you start to curing it, prevention is always better. So what we need to do is to put a stop on the domino effect. You get a hypertension, and then you will have some complications. Then slowly you develop some eye problem, some heart problem, and some maybe liver or kidney problem. So this is basically a summary that actually we should be watching out. Dr. Chai do also explain on this, but I want to ask you, which zone do you belong to? All right. So for blood pressure or blood glucose of below this level, you are quite fine. So what you need to do is that you will have to maintain your healthy lifestyle. And on top of that, you should go for a regular checkup, right? It does not mean that you are in a safe zone. A green zone means that you do not need for any medical attention, because we will age, okay? Our lifestyle will change. We might have stress. For example, during this COVID season, everyone is quite stressful. So this might change our body and our blood pressure can go up, our blood glucose can go up. Okay, if you are in the yellow zone, all right, then you need some attention. It is time for you to change your lifestyle, because we still have a chance to modify it. But once you go into the red zone, all right, this is a proper diagnosis of hypertension or diabetes. Then you are not good at all. You really need some medical attention. All right, you really need to do some treatment. All right. So what are the risk factors that actually we need to be aware of? Basically, these are the things that you are quite familiar with. Any unhealthy diets, any lack of physical activity, obesity, if you drink too much, if you smoke, all of these are the risk factors. But there are some risk factors that we can't change, like our gender, okay, our age. We grow, we can't stay young for forever, unfortunately. So we will grow old. And as we age, we are at a higher risk of getting hypertension and high blood glucose level. All right. So what we can work on is actually the modifiable risk factor. Okay. Start to take lesser salt, start to take less oily food. Okay. Do more exercise. If you are overweight, try to cut down your weight. Okay. Stop your tobacco use. Do not smoke and do not drink. These are the best way for stopping you to get a diabetes, hypertension, and high cholesterol level. All right. So, and as we mentioned, the 3 highs is a progressive chronic disease. All right. Start from we being healthy. Okay. Slowly we have some pre-disease. Your blood pressure wasn't that high to formally be diagnosed with a hypertension or high blood pressure, but you are at risk, high risk of hypertension, as some of you have asked this question. So what you need to do during that time is to have some lifestyle modification. And this lifestyle modification is not just doing by your own. You really need to sit down with a doctor or nutritionist or a pharmacist to plan things out. And it is not for forever. All right. You have to give yourself a time frame. For example, based on your severity, you can set a timeline of 3 months or maybe 6 months to try to change your lifestyle, your habit, and your eating habit and your exercise. Okay. If it does not work, then we really need some medication to help you. All right. But once you have been formally diagnosed with hypertension or diabetes or hypercholesterolemia, on top of lifestyle changes, you will need medication to control it. All right. For each of the different 3 highs, we will have medications that actually to lower it down. I welcome you to ask any questions later. Okay. But unfortunately, if let's say you do not stop the 3 highs at the disease stage and it progress into complication, all right, what will happen is that you might experience a stroke, you might have heart attack, your kidney does not work. And today our interest will be our eye. You have the glaucoma, you have the cataract. Then unfortunately, on top of medication, you need some surgical intervention. And Dr. Chai is here to help you. Okay. But for medication, welcome to ask me. And of course, the one thing that we do not want it to progress is when the disease becomes so severe, the end of the day, it will be the death. All right. So what we can do is we put a stop between the pre-disease and disease. Before it progresses, we stop it and we control the blood pressure, we control the blood glucose, we control the cholesterol. And hopefully by that, you will not have any complication and do not have any eye problem. All right. So I have a story to share with you. This is the question I always ask my friends or my customer or my colleagues or even my patient. How young are you? Okay. This is a story about one of my patients called Mr. M. Okay. Mr. M is about the last time I met him. I mean, he unfortunately he passed away. The first time I met him is he's about 33-year-old. All right. He's 33-year-old, middle age, not really middle age lah. He's still quite young. Okay. But he's quite thin. Right. What happened is that he feel very tired and he feel very tired and does not have any energy to work. Very hard to concentrate during his work. And what happened is that he come to the hospital and seek for medical attention. And that is how we actually encounter this patient. What happened is that we do a thorough checkup. We try to check all the vital signs, the blood pressure, the blood glucose, and we found out that he actually is having a diabetes. All right. And when we ask him that his diabetic level is the blood glucose level is quite high, I still remember that. And that at that level, he really needs some medication to control it. It is no longer at the stage of you can change your lifestyle and you can actually go back to normal life. No, he's at the stage of needing some medications. So when we ask him, are you ready to start with your medication, this and that? And what he responds to us is that he already know that he have this high blood glucose level, but all this while he's quite fine. So he don't think so he needs some medication. So he actually refused our help and he requested to be discharged from the hospital. And of course, we have to respect his view. So, but unfortunately, he just went off. And the second time that he came back, he still follow up with us. He still attend the appointment with us. But the second time he came and see us, he told us that he has been start seeing some Chinese bomoh in Ipoh. He was from Kajang, but he has traveled to Ipoh to seek some help. And that Chinese bomoh actually give him some pills that he's not sure what kind of pills is it, but claimed can help him. And after taking for a month, he claimed that it actually helps him. He become more energetic and he can focus. But when we try to test for the blood glucose, it is not good at all. Okay, it is still very high, even worse than last time. And the third time I see him, he was sent by his family member. And what happened is that he's not very conscious. He's very delirious, not so sure about what's happening with surrounding, cannot recognize people, cannot recognize his family, and then not sure about the time, the date, etc. And what happened is that we do a thorough checkup. We found out that his eye is no longer having any vision. He go blind due to diabetes, and his kidney is not functioning anymore, and he need a dialysis during that time. And when we look at him, we can look at his body feature. We suspect that the pills that the Chinese bomoh gave him is actually adulterated with some sort of steroid. That's why after he ate it, he feel very energetic. But what happened is that we suspect that the diabetes as well as the steroid actually make his eye go blur, loss of the vision, and as well as causing his kidney. So that time, although he's very disorientated, but when we ask him to get a medication and ask him to do the dialysis, he's still refusing it. So fast forward, after a few months later, he actually passed away in the hospital. So the story is that what can we learn from Mr. M? First, don't be escapism. Okay, when you detect that you have a diabetes, when you detect you have hypertension, hypercholesterolemia, go for a treatment. All right. Once you have been diagnosed, we can help you to stop it for progressing into complication. The longer you drag, the worse the outcome. That's why he lost his kidney, he lost his eye. Okay, and seek help from a licensed or registered practitioners. All right, make sure the doctors that you see, the healthcare practitioners that you see, is actually a license, and do not take any unknown products from an unknown source. All right, make sure it is registered with the Kementerian Kesehatan Malaysia for supplements or medication. Make sure it is a registered one. All right, and be compliant. And the complications, right, is a long-term issue. So as soon as you detect it and you put a stop, let's say for example during the first visit when we put a stop at it, we can actually prevent all these drag outcome. Okay, he do not need to lose his life at the age of 34. Right, it's too young. Okay, so this is the what we can learn from Mr. M. So why do people refuse medication? Okay, because there are a lot of myths that people misunderstand. Okay, for example, this is the common questions I always receive. I just wish to share with you. People always say that once I start with medication, I will have more and more medication, and it is a route of no return. Actually, for me, it is not true. If we can control your 3 highs at the early stage, what happens is that we are expecting you to cut down your medication slowly. All right, you might not be able to totally get off from medication because so far I only see like 1 or 2 patients like that out of so many patients I've seen. But eventually you will cut down your medication if it's well controlled. Let's say from 1 tablet become half a tablet, or from 2 pills become 1 pill. All right, there is a progression. That is really a progression. Okay. Second, I can stop my medication once my blood pressure, blood sugar, or cholesterol is back to normal. Unfortunately, it is not true also. When you do a checkup, when you're on medication and you do a checkup, your blood pressure appears to be normal because your medication is taking the effect and helps you to control it. So once you stop the medication, it will rebound and back to hypertension again. So the medication there is very crucial, and it is a long-term thing. Unless you are advised by the healthcare professionals to stop it, do not stop yourself. All right. Okay. Third myth. The medication that control my blood pressure, sugar, cholesterol will harm my kidney, liver, and eyes. All right. This for me is not true also. In fact, some of the medication that you are taking, the hypertension medication that you're taking, they have the effect to protect your kidney and your internal organs. Okay, instead of harming it, it do have some protecting effect to your internal organs to make sure that you don't get a heart attack or kidney failure. Okay, and do they have any side effect? This is also a common question asked during when they ask whether it will harm my kidney or not. I would say yes, everything comes with a side effect, but not everyone will get the side effect. I will just give you a metaphor. I believe some of us cannot take milk product, dairy products, or cannot take seafood, but not all of us is suffering from allergy, right? Some of you might have a seafood allergy, for example. So it is the same for medication. Some of us will not be suitable for certain medication. Okay, they might develop some kind of itchiness, for example. Okay, so what you need to do is that just talk to your healthcare professionals, talk to your doctor, and we can switch another medication, and it can be resolved. All right. So in summary, early detection of 3 highs help us to put a stop on eye disease, and a good control on blood pressure, blood glucose, and blood cholesterol is the key preventive measure for you getting on any complications. All right. And third, if you are in doubts, don't be shy. Always discuss with your healthcare professionals about your doubts and issue, and we will help you with your decision. All right. You face some issue, you face some side effect with your medication, always talk to the doctors or a pharmacist. right? We can help you to sort it out. We have many kind of meditations. If A does not work for you, we will have B, C, and D in the line. All right. So do not worry about that. Okay. So I will always emphasize it is never too late to take an action. If you have never done a health screening before, go and do it. If you are having some issue with tree highs, go and seek for medical attention before it progresses into a complication. All right. So visit a clinic nearby or pharmacy nearby to get your health check lah. All right. So thank you very much, and I really appreciate this opportunity to share with all of you. Yep. Thank you. So back to you, Dalila.
Thank you, Dr. Chong, for walking us through the eye-opening presentation. I couldn't agree more. Prevention is better than cure. So once again, thank you, Dr. Chong, for providing us such valuable information about your topic. And to the viewers now, fret not and start dropping us your questions, because we'll be having Dr. Chong again during the Q&A segment later on. Okay, stay tuned, everyone. We will have a giveaway session. Remember, share this FB Live now to join and take note all the important facts. The first 5 people who will answer our correction correctly will win 5 exciting gifts. So let's get right into our Q&A session with our first questions for our speaker. So the first question will be for Dr. Chai. This one is from MDAK. Does the damage from this disease come in quickly or slowly to the eye?
Okay.
Do you mind to elaborate?
So first of all, we need to understand for patients with 3H3 highs, right? This kind of damage is irreversible to the blood vessels. So what happens is in the long run, so the damage is progressively worsening. So in the long term, we will get this kind of impact over the eye. So what I feel like, if let's say you have the 3 highs for quite some time, so you need to do a regular checkup at our center.
Okay, so that one is done. So let's move on to another question for Dr. Chong from Fiona Tong. How often I should do a full body checkup to know my health condition?
All right. Thank you, Darila, for the question. Okay, to answer that, usually for body checkup, it depending on a few factors. For example, your risk factor, how high risk are you for getting this 3 high? And second, most important also is age. Okay, for younger adults like me, so what I need to do is an annual checkup at least once a year. But let's say if you are at risk of getting a hypertension or any complications that you have known of, for example, your family is having that issue, you can do a twice a year checkup also. Yeah. So it's very highly depending on the age as well as your history. Yeah. So at least once a year. Yeah.
At least once a year. Is there any difference if they say, because I did read from Google, like people below 40, maybe like once every 2 years, is it okay also?
Okay, here's my opinion on that lah. Because if you have realized, I'm not so sure if you have realized, recently we have more and more younger adults that get a hypertension, the 3 highs, as young as the age of 20 something. I have seen patients with age of 25 get a heart attack. Okay, but because they are quite young, so they can recover very fast. So I would say, even if you're young, try to do it once a year. Yeah, I'm doing it annually. Yes.
I should ask all my friends also to go with me.
Yes. 25 for a heart attack, and I had a case of 27 for a stroke.
Wow.
Yeah. It's very young, right?
Yes, very young, 27 for a stroke. Okay, so moving on to the next question. So this is from Facebook. The asker is Ida Sam. Hi, Dr. Chai. After the treatment of hypertensive retinopathy, is the vision of affected eye can be back to normal?
Okay, this is a good question, sir. So from my just now presentation already mentioned, actually the best is for the early detections and the early treatments, right? So it depends on the severity of the diabetic retinopathy. So in a mild form, in a moderate form, and it depends on the macular status, whether it's very swollen or how. So from there, we'll justify, provide you expert opinion, whether the visual prognosis after the treatment, like injections, like laser, how good the vision can come back. But if let's say there's a quite serious stage, like almost going to end stage, right, that diabetic retinopathy is a bit hard to get the original vision, right? So let us bear in mind. That's why there's the importance of early detections and early treatments and checkup.
Agree with that. Okay, so the next question for Dr. Chong. Okay, this is from Nash. Okay.
Alright.
Hi, Dr. Chong. The question is quite long, so maybe you need to really listen for it. Hi,
Yeah.
Dr. Chong. My mom has high cholesterol and high blood pressure. However, her readings have been normal for at least 2 years now. She only eats her high cholesterol medication if she eats heavy food on that day, example, rice or red meat. If she controls her food, she will not have the medication. Is it okay for her to take her meds occasionally like that? Or should she continue eating her medication every day as prescribed by her doctor when she was first diagnosed with those illnesses?
All right. Thank you for the question, Dalila. Okay, to answer Nash's question, so I just recap a bit. So her mom basically had a high cholesterol level as well as a hypertension.
Correct.
This issue. Okay, but the reading has been normal. I assume that reading is for blood pressure. I'm not so sure, or for the cholesterol. All right, and she only eats when needed. So here's my share. Okay, the effect of blood cholesterol medication as well as the blood pressure medication, it is not only just to control the readings only. Some of the things, right, that it helps to prevent, it is not shown by the blood pressure reading or the cholesterol reading. For example, when your blood vessel, there's accumulation of your cholesterol and causing a thinning of your blood vessels, right? That kind of things, right, is not it is not detectable from your blood pressure or your cholesterol level. And what happened next is that suddenly she might experience some sort of heart attack or stroke. That's the thing that we want to prevent using all the hypertension medication or cholesterol medication. And whether does it like eat occasionally like that, does it work? Or when I eat a heavy food, then only I take my diabetic medication, does it work? Actually, it do not work. All right. The medication, it will take some time, take maybe about like a few days continuously eating for it to exert an effect on your blood pressure or the cholesterol level. And it takes a longer time, a few years, maybe down a decades for it to exert a protective effect for the medication. In fact, when this medication came into market, right, the studies that we actually, the clinical studies that we conduct on it is actually throughout a few years, a long term. Some of it we even study it for like 10 years, 20 years to make sure that it really protect your heart, really protect your kidney, really protect your eye. So on and off taking the medication, unfortunately, it does not help you. Yeah. So, but the concern that I'm having right now is that since she already stopped the medication, what I would advise is to go and see the doctor again and to discuss again her current health condition, okay, to have a clear picture on it and to decide whether how should we restart back the medication, because after some time your body condition might change. Yeah.
Okay, so I hope Nash got the answer for that, and please bring your mom back to the doctor, right? So that
Yes.
so that the doctor actually can evaluate again either that she need to take the medication or not, correct, Dr. Chong?
Yes.
But I think this is also quite a common cases, I think, for the elders in Malaysia. Like they only take medication if they feel that they want to take it, or maybe they feel that, oh, I'm not really feeling well today, so maybe this is because of my disease, so I need to take medication. I think this is quite a common cases, right? Even Dr.
Yes.
Chai, do you see these kind of cases in clinic?
I always encounter.
So usually with this patient, what will you do actually?
So basically, I think compliance is very important, regardless of what. So to maintain the optimal level of the range of the diabetes, blood sugar and lipid, right? So very vital to prevent the damage of the vessels. So I still will emphasize that you need to be compliant to your medication. If you feel there's any symptoms systematically, a dizziness or whatever, you go back to your treating doctors. If you have any eye problem, you come to me. Yeah.
Okay.
Mm.
All right. Okay. So moving on to the next question. I got another question for Dr. Chai. The asker is Monica Wong. I understand it's okay or normal to see some floaters and there's no treatment for it. What are the symptoms in a floaters condition where I should be concerned and should see a doctor for eye check?
Okay, so whenever anybody have floaters, right? So they'll be quite worried because they see something moving, side to side. When you move to the left side, move to the right side, you follow the floaters. The kind of floaters we call it as. So in this kind of case, right? If you have a risk factors like, for example, a high short sightedness, or you have an underlying diabetes, right? 3H that I mentioned, right? So any other medical problem, right? You better have your eye checked, so that you need to exclude that all these possible diabetic retinopathy, hypertensive retinopathy, or it could be a stroke in the eye. So for those patients who is at the high risk, you should have a checkup. So for those patients, floaters associated with flashes of light, also potential to have a retinal detachment. So this type of patient, where they experience have vision blur, you need to seek for ophthalmologist advice as soon as possible. Otherwise, like floater, it could be mild symptoms like, for example, posterior vitreous detachment or that floaters, but still you never know that before you do the checkup, you never know that this is just a mild problem. So still, I think if you experience the floaters for the first time, I think it is safer to have at least a baseline checkup to ensure that your eye problem is not that dangerous. Thank you.
Okay. All right. Okay. Another question for Dr. Chong. I believe just now when during your session you did emphasize about this, but I think maybe you can re-emphasize about this here.
Okay.
Okay. The question is, there's a belief that once start on medication for high blood pressure, then we will need to depend on the meds for the rest of our life. Is that true? As that belief is also making a lot of people reluctant to start on medication.
Okay, thank you for the question. Is it true that once you start with the medication, you will be depending on it for
Yes.
life? All right. I will just twist the angle a bit. Okay. If you start your medication today, you might only maintain this one medication for your entire life. But if you decided not to start today and you want to wait until something pop out, you might be stuck with 5 or maybe 10 medication for your entire life. So which one do you prefer? That's the question. So to be honest, both my parents, they are both of them are hypertensive patient, and both of them being very nice patient. They only take one medication for the past 30 years.
Wow.
One medication. Okay. In fact, my mom has been cutting her medication from 1 tablet to half a tablet. Okay. That was like 2 years back. So, but I have seen patients that in the hospital lying on the bed having like 10 medications because they never try to control it. So when I look at the numbers of the pills, I myself also get scared. So yeah, I would say, is it true for forever? It is very depending on how your body change in a later stage. Some I do see that they are off from medication when they really make an improvement, like their body weight, they really cut down their alcohol, they really stop smoking and really work on it, and finally they are able to cut down on it and just be on a regular checkup. But usually that kind of patient, right, is quite the early stage, not the later stage. Still in the borderline of pre-diabetic and the diabetic, borderline of hypertension and pre-hypertension, around there. Then they started medication, they really work on it, and they really like go back to healthier, still a bit high, but they do a regular checkup. Yeah. Okay.
So I think the key is regular eye checkup, and also all those healthy lifestyle is actually the keywords on how to dealing with these 3 highs, right, doctor?
Yes, of course.
And do it early. Yes, and do it early.
Okay, all right, I get it. Okay, and then another question for Dr. Chai. Doctor, if a diabetic patient that on medicine to control sugar level get eye disease. Hang on, let me recorrect this question for you. I think she actually mentioned that if a diabetic patient that on medication, which means she has a controlled diabetes mellitus, can they still get any eye disease even though they're having this controlled sugar level?
Okay, so most of the people might think of, okay, my blood sugar is controlled, no, on and off whenever check up, right? Shouldn't have any eye problem. What I feel like is a wrong concept. So actually our blood sugar or even though our blood pressure or even the lipid is actually fluctuating, every time, morning you take the blood result doesn't mean that your afternoon or your evening is still all right. So in this kind of case, right, especially the duration is quite long, you have diabetes like more than 10 years, 20 years, right? More or less the damage is there over the vessels. So it's best to have a checkup to find out what is exactly your problem, your disease severity. So I think should have a eye checkup still. Yes,
Still.
thank you.
Okay, all right.
Yes.
So, all right, due to the time constraint, I think we can afford to take in perhaps another 2 questions before we conclude the session, yeah? All right, so for the next question will be for, again, for Dr. Chai. Is it possible for someone with high blood pressure to have high eye pressure as well, or it is not associated actually?
Okay, so let's talk about high intraocular pressure. We call it as it means the pressure. We have the pressure in our blood vessels. We have the pressure inside our eye. So inside our eye is called as intraocular pressure. So in this kind of intraocular pressure is high. So we always think about glaucoma. Okay, glaucoma is a disease whereby it's a silent stealer. It's a vision silent stealer. Normally affect the peripheral vision. Then only slowly at one stage you'll be at the center, remain the tunnel visions. So this kind of case, right, glaucoma, hypertension is one of the risk factors for glaucoma. Okay, so those who have hypertension, you need to have an eye check to exclude that whether you have glaucoma. So it is possible still you have a high intraocular pressure because you have a hypertension. Thank you.
Interesting. So you might have high eye pressure or you might not have the high eye pressure, correct?
Yeah.
Okay, all right. So I think those will be the last question. I think it's a very simple question, but actually not every people also know about it. Okay, so for Dr. Chong, where can I check for medicine content?
Okay, this is a very interesting topic.
Yes, correct.
So let's say, for example, in the box of your medication, there's actually a hologram tag. All right. So that hologram tag is actually telling you whether these products, right, is actually go through with the Kementerian Kesehatan Malaysia or not, the Minister of Health of Malaysia, right? That can actually tell you the genuine of the medication. And on the box of the medication, it usually come with a registration code for their products. All right. It always starts with MLA, okay, and then a series of number, and at the end of it, there's an alphabet. It can be A, it can be T, it can be X, and it can be other alphabets to indicate what kind of medication is it, right? That actually tells you this product whether it's registered or not, right? And this is not only restricted to medication. Some of the cosmetics also, they have to register with the Kementerian Kesehatan Malaysia, right? But they do not have the hologram and the code lah. They have a notification number. Okay, that's one. Secondly, on the box itself, it should be clearly printed the brand name of the medication, as well as the chemical content of the medication. Okay, that will tell you what kind of medication is this. But if you are not so sure, you can always carry the box and visit any pharmacy. Pharmacists will help you with that, right? They will tell you this product, is it a registered one or not registered one? This product, whether it's a genuine one or not a genuine one, all right? They will know, right? All they need to do is you just show them the box or the blister pack, they will know. But try not to just show the pills, yeah, because all the pills look alike. When you say white color pills, all the pills is in white color. Orange color, all is in orange color. So we can't tell. Always carry the packaging. And third thing, whether you can suspect something is wrong, is that if the medication comes without a packaging, that is a red flag, right? That is a red flag. Like the pills that does not have a blister pack, it is not in a bottle, it is not in a box, then it's a red flag telling you that something is wrong, especially those without a label.
Okay, just a quick question from my side, because I know
Yeah. Sure.
mentioned this is the last question. So because previously you did mention in your story that got one of your patient going to take medication from the BOMO, thing like that, right?
Yeah.
So we can conclude that usually medication from those BOMO doesn't have any labeling, so that is totally red flag.
Yeah, it's just totally red flag.
Totally red flag.
First of all, they are not a registered practitioners. So legally saying, they should not give out any medication. Ethically saying, they are on the wrong side already. Okay. So ethically and legally, it's not good. All right, it's totally out of the picture. So, and then when they give you in a plastic bag, like a, those IKEA plastic bag, and then just ask you to take this whole bag for the whole day without any labeling, you are not so sure what's the content. Is it from a herbs, from a herbal products, or is it from animal parts, or it is a chemically synthetic one? You have no idea at all, and you dare to take it if I'm giving you a food without telling you, hey, this is actually chicken or fish or anything, just a lump of meat, and telling you, go and take it. You will not dare to take it. What about medications? So it's the same concept. Yeah.
Agree. How about you, Dr. Chai? Because as both of us coming from ophthalmologist base, so I think we both actually encounter a few advertisement in Facebook saying this kind of eye drop can help to cure your bleeding in the eye, things like that. Have you ever encountered those kind on patient?
Yes, of course. Actually, all this is quite common. Whenever a patient comes to me, they even come with that kind of medication and show me, is it effective, doctor? Is it saving my eye? Is it treating my eye? All that questions pop up to me. So I think, first of all, I'm not very sure what is the content inside the eye drop, so I cannot give a very expert opinion on the behalf of my professions. So I would like to say that from my per se, I would ask them to stop it. If you still have that kind of visual disturbance, then you receive my treatments. If that is all right, then continue with my treatment, right? So I think if there's no, what Dr. Chong already mentioned, if there's no any proven facts that regarding the safety concern, I think we need to be more cautious with the usage. The potential side effect we cannot be ignored.
Yeah, and I just wish to highlight on eye products, and especially for eye products like eye drop or any eye ointment or eye creams, right? They are very special in a way. The way that we actually manufacture it in the manufacture plant. All the eye products, right? They are supposed to be sterile. Means that no bacteria, no germs inside it. We cannot tolerate a single germs in any eye products. So they are very clear, because our eye is very precious and very sensitive. A bit of germs, right? You go turn red and you have an infection going on already. Unlike our skin, our stomach, that we can actually tahan a bit lah, right? So any unregistered products from outside, you are not so sure whether they are like totally clean or not. They might have some residue, like undissolved residue, or maybe some sedimentation that can actually harm your eyes. And on top of that, you have germs inside it. So it is not advisable. I strongly discourage to try any eye products from outside. Yeah.
Okay, so remember everyone, whenever you're getting your medications, doesn't matter, is it eye drops, even oral medication, please get it from your registered pharmacy, or make sure it has labeling. All right. Okay, so I think we can conclude our Q&A session at this moment.